Okay, thank you very much for inviting me to speak today, and huge apologies that I couldn't be there in person, but really appreciate the opportunity to talk a little bit about some of the work that we've been doing in Dundee. So I was asked to specifically focus on the work that we've done around trauma-informed leadership and also the lived experience work that we've been doing. So I'm going to cover that in the presentation today. So in Dundee, when we started thinking about trauma-informed implementation back in 2018, 2019, probably much like everybody, we sort of thought, where do we start with this? Because it felt really kind of big and overwhelming. So the early focus and direction that we took in Dundee kind of took a specific angle around leadership and workforce lived experience, more specifically than just lived experience on its own. And there were a number of reasons for this. So one of the reasons was we knew that there was an opportunity to bid in for some funding that was available at the time to look at pilots around trauma-informed practice across Scotland. And we submitted our bid in 2019 with this focus on leadership. And part of that was because we knew that other areas had focused on more kind of frontline approaches. So we thought, let's do something different and kind of look at the leadership side of things in Dundee. So that was one reason. And the other was really the fit with Dundee and what was happening in Dundee at that time. So there were a lot of kind of redesign and transformation activities ongoing at that point. One of those was our Transforming Public Protection programme, and the importance of trauma-informed practice was very much included within that. We'd also recently had the Dundee Drugs Commission, which some people might be familiar with. And the quote on the slide is a direct quote from the report, which basically spoke about if we were going to transform what was happening around substance use in the city, which had obviously quite a high level of drug deaths and so on, we really needed strong leadership and determination to stick with what will be a difficult task. And the partnership would not succeed in turning things around without that. And that those delivering care and support in Dundee must build relationships which are based on respect and trust. And these will provide a starting point for working effectively as a true and equal partnership. We believe that a shared culture is needed which values kindness, compassion, and the belief in hope. So that kind of push from the Drug Commission report really chimed with everything that was included in the trauma-informed work. So that was sort of how we ended up with the focus on leadership to begin with. We also had that inclusion of a focus on workforce lived experience, but we'll talk about that more in a minute. So in terms of leadership and what we've done, it's kind of been ever evolving. We haven't sort of done one piece of work and then it stopped, it's kind of continued. And the leadership work has been really entwined with the workforce lived experience work, which both in turn contribute to what we hope to see with culture change. So the first thing we obviously did was establish a steering group for our trauma work, and that has gone from strength to strength. The initial resource that we got through that bid submitted in 2019 consisted of some training input and support from NES to deliver the STILT training to our chief officers group and other senior leaders. And we delivered that at the beginning of 2021, just after COVID. We also then had the introduction of the senior trauma champions that was requested across the country, and that's actually really helped in terms of the leadership strand of work. So we had our head of HR, chief exec of neighbourhood services, and head of health and social care as our senior champions, and they really brought quite a lot of additional traction to the work. We've done ongoing pieces of work with elected members and IJB members, and we worked with the Improvement Service to kind of develop some materials and resources around that as well. And that again has been ongoing. We haven't just done a one-off event. We kind of continuously provide updates to elected members and IJB members on what we're doing around trauma, and they've been really engaged and wanting to hear about what we're doing and also wanting to implement it themselves. In 2021, I think we ran an event with the Dundee Community Planning Partnership around violence against women and trauma. So again, we reached a lot of key leaders through that event, and often leaders who maybe wouldn't be engaged in that conversation normally. Our Chief Officers Group runs a sort of workforce collaboration event, usually annually, and in 2022 there was a really strong focus on our trauma work at that event, which was great and reached a kind of really broad multi-agency audience. We've also been involved in the Authentic Voice project with Safe Lives, Improvement Service and Resilience Learning Partnership. And our focus with that piece of work was specifically how do we hear the voices of people with lived experience at strategic level, because we felt that we were doing fairly well with that at kind of an operational frontline level, but we weren't getting enough of that at the sort of decision-making forum. So that was a big piece of work that really kind of brought a trauma-informed lens to conversations as well. And the most recent thing was the Dundee City Council Corporate Leadership Conference that we were asked to speak at, and I'll talk a little bit more about that further on. But I think the key point is because we had that early buy-in and commitment through doing the sort of the stilt work with our chief officers and senior leaders, all these other pieces of work have been things that have been requested from us rather than us going and saying to people, we think you should be doing this. So it's been a really open door, which has been fantastic. So the other strand that we focused on was workforce lived experience. And again, like I said, this was really linked to the idea of culture change. So we really kind of strongly felt that we were missing a trick if we didn't think about those people in our workforce who have lived experience. We know that lived experience, kind of co-production and voice is a really powerful tool across all different areas of work, whether it's service design, redesign, policies, whatever it may be. But traditionally kind of thinking of that as people who are currently using services. And while that's really important and we absolutely need to be thinking about those people with lived experience, we just didn't seem to be making a connection that there are probably vast numbers of people across our workforce who will have lived experience. We only need to look at the numbers in terms of trauma and experiences of trauma to kind of work that out. Probably within a staff group of 100, you'd have at least 20 people with lived experience of some form of trauma. So we kind of started thinking about that, and we're thinking, in terms of the culture change bit, if we can break down some of that power imbalance as well of seeing ourselves as the professionals and those people as the service users, that we could start shifting the culture much more. I'm thinking as well that it's potentially as damaging for us as workers, because we're not separate. We're humans just like everybody else. And it could improve our ability to connect with clients, build trust, help us get deeper inside experiences, and also just bring that ability to influence change from within the workforce as well, and take that pressure off us as workers to sort of hide aspects of ourselves, because there's still a lot of kind of stigma and shame and guilt around experiences of trauma and being open about those, particularly at work. So that was our thinking around the workforce lived experience. So we started to kind of seriously think about the idea and wrote the idea. And it was met with quite a lot of surprise, worry, concern, not really blockages or barriers, but just people genuinely thinking this sounds really odd, because it is odd compared to the kind of what had been happening up until that point. So we had conversations with the trauma steering group, we had conversations with HR, we had conversations with trade unions, and we worked really closely with some psychologists to develop a safe and ethical process, because that was the main worry that people had, was if we do this, are we potentially opening up problems for people, re-traumatizing, so on. So we did all that work. It took about a year, and then we came up with a process, and everybody was okay with that. So we launched the Workforce Lived Experience Group. We did it quietly to begin with, because we wanted to get a small group together and sort of try it out. So we did a big launch event of all of our trauma work and mentioned the Workforce Lived Experience during that. We've also been rolling out manager briefings since we started our trauma work, and so we also talk about it within there, because one of the things that we say is that anybody joining the Workforce Lived Experience group really needs to have their manager's support to be part of that so that there is that kind of support when they go back to their team should they need it. So once the information went out about the group, people started to sign up. There was a form that people could complete to say they were interested, and then we send them further information about what's involved so they can make an informed choice. If they still want to continue, there are two of us who then carry out a sort of screening conversation with people. And the screening is not screening their kind of ability to be part of this. It's more to make sure that they understand what they're coming into. We get a sense of their expectations, and we can make sure that they are in a place where they feel safe and comfortable to be part of that work. So we do that. And if they definitely still want to continue, we then kind of sign a consent form, kind of outlining all the things that need to be in place, and they're then invited to the group. So we've kind of stopped at around 12 people in the group, and those people kind of dip in and out. They don't all attend all the time. And we've been meeting monthly for about a year. We've spent a long time forming the identity of the group, so making sure that there were clear boundaries and that the confidentiality was really clear. There was a really clear purpose for people being involved. But we didn't go to the first sort of few meetings of the group with an idea of what that was going to look like. We wanted to do that with the group. So it's taken time to build it, but we are just about to launch an offer, basically. So the Workforce Lived Experience Group has decided and agreed that they want to offer a consultation function to Council, Health and Social Care Partnership, NHS, and potentially wider once we get to that point, for any piece of work that might be about to be carried out where someone identifies that having a trauma lens on that piece of work would be beneficial. So there's a sort of a whole process in place for that. There's a request form, and then the group will kind of discuss who's best to get involved with that piece of work, or whether it's the whole group. But we're also going to identify things ourselves which we see in the workplace which we think needs some attention, and we would then kind of contact the relevant person to talk that through. So as much as it's people coming to us for consultation, we'll also be identifying things that we think need to be worked on. So really excited to kind of be at the stage of launching that. So we have had a little bit of feedback from the people who've been involved in the group, and this was just one quote that we thought was really nice. So this person said, being part of a catalyst for change towards employees with trauma experiences is a really positive experience and makes me feel proud that as an organisation we will be one of the first actually doing this work. Having lived experience of trauma has always made me feel this is something I have to hide from my employers, as I didn't want to feel judged for the effects this can have on both my mental health and physical health at times. Since joining the Workforce Lived Experience Group, I have become more trauma informed and actually understand myself so much better. I've done lots of reading around trauma and feel this is actually improving my own practice in the workplace as a result of joining the Workforce Lived Experience Group. So just really, really nice to hear that not only is it beneficial for the kind of, organisations, it's clearly having a beneficial effect for the people involved. So that was fantastic. And just quickly kind of touch on the corporate leadership conference that we recently spoke at. And we were asked to go and speak about the Workforce Lived Experience Group and the work that we've been doing. And again, we kind of had this feeling that we don't want to create another us and them across the organisation, where you have the Workforce Lived Experience Group, who are the sort of the brave, resilient people who are willing to do this lived experience work, and then everybody else who's okay and not experiencing anything, because we know that's not the case. And particularly leadership, that kind of idea that you have to put your professional face on and come to work, leave your problems at the door. So kind of flipped it on its head a little bit when we went to the conference. We did talk about the Workforce Lived Experience Group, but we also really sort of focused in on the leaders in the room, and the idea that leadership in itself can be a really difficult place to be, in terms of, anyone who is a leader will recognise that you can be unpopular, you can get a lot of blame, you can get a lot of criticism. It's not always a comfortable place to be. And then if you couple that with having some stuff going on in your own life, which people do kind of, regularly, that's a lot of pressure. So we really got the people in the room to sort of think about how trauma impacts them as well, and we didn't let them off the hook with creating a little us and them with the Workforce Lived Experience Group. And some of the feedback we got, just a couple of quotes. very moving, honest and authentic. It allowed me to reflect on my own personal circumstances and events in my life which have shaped who I am today. And someone saying I don't need a PhD to understand the theory behind it. It has affirmed my current practice and values, and I felt uplifted. So it was a really, really kind of good, positive piece of work that we did there. And in terms of the future, with both of these strands of work, we're going to expand the Workforce Lived Experience group in the near future to include non-kind of council, health and social care and NHS organisations. So we've got a process for that. The council are doing a policy review currently with their HR policies. We're going to be looking at our messaging and comms, and that will include our Workforce Lived Experience group and our Trauma Ambassador network. We are going to be using the National Leadership Pledge, but also kind of developing a local one that focuses more on our local implementation plan. We're looking at the governance of trauma work and where it sits in our public protection structure, and our learning and organisational development colleagues are weaving trauma-informed practice throughout all the kind of leadership offers that are available across the council already, so that we're not necessarily doing something new, we're kind of weaving it into things that are already part of the system. So lots of work to come, but lots of work that we've done, and kind of really proud, particularly of the Workforce Lived Experience side of things. And thank you very much for having me along to speak today.